Good afternoon. My name is Taylor Simmons, and I would like to talk to you a little bit about Rocky Mountain Spotted Fever. Just a little introduction on this disease. It was first medically described by Dr. E. Maxey in 1899, but before then it would have been widely known to the natives and anyone else that had found themselves in the Rocky Mountain region around that time. It is still found in large portions of both North and South America, but I'm going to focus primarily on the Midwest region today, just to make it the most relevant to us. Rocky Mountain Spotted Fever can be fatal, but now it is relatively easy to treat. The fatality rates have dropped to almost nothing with the use of modern antibiotics. A little background here. This disease typically sees its peak occurrence in the early summer, which makes sense because that coincides with the hatching time of the ticks that are infected and actually spreading this disease. Rocky Mountain Spotted Fever is caused by Rickettsia rickettsiana, which was the causative agent described in 1908 by Howard T. Ricketts. In the Midwest region, we primarily see it in American dog ticks and Lone Star ticks, although in other parts of the Americas, other ticks transfer this bacteria as well. A little about the chain of infection here. Again, that infectious agent is R. rickettsiana. The reservoirs, like I said, for the Midwest are going to be that American dog tick and the Lone Star tick. But in the more western areas, you can also get it from Rocky Mountain wood ticks and brown dog ticks. The mode of transmission is going to be from direct contact of blood or fluid to the skin, although it cannot be transferred person to person. The portal of entry is going to be when that tick punctures the skin, actually passing the bacteria to the host, or just direct contact of fluid from ticks. And I add that last part about direct contact without the actual bite from the tick, because if you squish them and either you have a small cut or you squish them into that puncture wound that they've already started, you're actually able to kind of smash that bacteria into your body and get sick that way. Susceptible hosts are everyone across the board, dogs, humans, small mammals. The symptoms of Rocky Mountain Spotted Fever typically begin about 7 days after exposure, but the range is usually 2 to 14. And this starts with a high fever that often exceeds 102 degrees, so it's fairly serious, which led to pretty significant death rates early on in this disease before the use of antibiotics. This fever, like usual, is paired with significant head and muscle aches. And for me personally, when I found out that I got Rocky Mountain Spotted Fever, my fever probably broke around the 4th day or so. And then immediately after that, I got this rash all over my chest that I'm going to talk a little bit more about now. So they say 2 to 4 days after the initial complaint of sickness, a rash usually will occur around the wrist or ankles before spreading to the torso. And like I had said, I got the fever and rash probably about 4 days after exposure, which was also my first day of initial complaint of sickness. I pretty well came home covered in ticks, immediately super tired, achy, and terrible feeling. So these are the classic symptoms, which are typically present in about 60% of patients. I'd like to move on to the case definition here, which is a little bit confusing, and there isn't much differentiating between the probable and confirmed case, but For a probable case, it would be if you report a clinically compatible disease, so sort of anything in the range of the spotted fever group, tick-borne illnesses, or if there is a blood test done with evidence of the actual infection, so a blood test looking for the antibodies. Confirmed cases would be if you're reporting, again, that clinically compatible disease or reporting significant or sufficient laboratory evidence. So, like I said, those are kind of confusing and basically the same thing. But this is due to the issues they face when trying to test for this disease, which I'd like to go into now. So the test used to actually detect these antibodies in the spotted fever group are going to be non-specific for Rocky Mountains fever itself, which means in turn that it is uncertain exactly what percentage of lab-confirmed tests are caused by which various spotted fever group. PCR testing is going to be the most efficient and effective way to test for Rocky Mountain spotted fever and get the most accurate results. However, that is not widely available, so most of the time you're going to see a blood test done, which allow the doctors to give you a definite diagnosis in the best of their ability, but more than anything, it allows for them to keep record of the incident rate of this disease, because Rocky Mountain spotted fever is a reportable disease. And with that, I'd like to move on to this paper here that was published by Santello et al. 2018. And in this, they were looking at the confirmed and probable cases in Missouri from 2011 to 2016. And this one here, you'll see Rocky Mountain spotted fever up top here, but it also includes other common tick-borne illnesses that you'll find in the area. And as you can see, the majority of the diseases have pretty low confirmed cases, even the Rocky Mountain spotted fever, because like I said, this has to do with the inability of the test to be 100% certain. But if you look for the probable cases, Rocky Mountain spotted fever heavily outweighs most of these other diseases here. Alright, so now I'd like to talk a little bit about the early treatment of the disease. And since it was so prevalent before the use of antibiotics, there wasn't much that they could do for you. It was typically just general supportive measures, things like cool sponges to help regulate your fever, codeine just to put you to sleep, and then they just recommend bed rest, fluids, etc. to try to get you over what appeared to just be a really terrible fever. So before the use of Rocky Mountain spotted fever specific antibiotics, 1 in 5 people infected with this bacteria actually ended up dying. The antibiotics were first found to be effective in the late 1940s, and then almost immediately started to be the go-to treatment for this disease in areas where they had access to it. Current treatment now hasn't changed much since then. They recommend you immediately begin your antibiotic treatment because the timing of treatment is going to be directly correlated to the death rates. They recommend that you prescribe doxycycline, whether it's for a child or an adult, and the CDC also recommends that the physician does not wait for the lab results, which in my case took about, actually took about 2 weeks or so, because they'll do 2 blood tests. They do the initial blood test, and then you come back a week later, and they'll do a second one, and it was my understanding that they did this to sort of compare the number of antibodies before and after, because the antibodies didn't always show up right away, because your body has to produce them. So They actually made me come back a couple days after my initial doctor visit because they said it was too soon to even take the test. But they went ahead and prescribed me doxycycline that day. And with that, the mortality rate has decreased greatly, from about 20% to less than 5% with the appropriate treatment. And that brings me to the reported deaths that were due to Rocky Mountain Spotted Fever in the U.S. From the 80s to the late 90s. And as you can see, the dark areas right around here and over this way, those were only 5 to 6 deaths in those 20 years. So it's pretty obvious how effective these antibiotics are in actually treating this disease and how important it is to get people the treatment promptly. I just wanted to compare some death rates here. Throughout all of the research that I did, it was continuously found that American Indians tended to be at a higher risk relative to whites for fatal Rocky Mountain Spotted Fever, with a relative rate of 3.9. As per usual, for the most part, children 5 to 9 and adults 70 plus showed a higher risk. Children had a relative rate of 6.9, while the elderly community was at a lower 3.0. So the national case fatality rate in the 1930s was, like I said, about 24% to 20-ish%. And this rate dropped all the way to 3% by the 1950s with just the introduction of the use of antibiotics. As these antibiotics became more widespread and more available, that death rate continued to decrease to almost less than 1% in the early 90s to 2007. However, during this time, it was seen that the incident rates were actually increasing, and this was due to a few different things. For one, just because your death rates go down does not immediately mean that it was because less people were infected with the disease. It just, in this case, meant that our treatment became much more effective at treating this disease. Along with that, improved testing, because before they just didn't have tests at all, so it was more off of just your symptoms, and there's an awful lot of diseases that leave you with a high fever and a rash, so it was pretty hard to distinguish between diseases then. So just simply the testing has led to an increased incident rate, and unfortunately, with climate change, we have seen a lot of warming in regions where ticks are pretty prevalent, and this just means that the ticks become more prevalent. The habitat is better suited for them and more widespread, so with more ticks, in turn comes more possibility for spread of disease. And this, I kind of wanted to segue into that tick habitat spreading that I was just talking about. As you can see here, in the 1870s to 1939, a large majority, almost all of the cases in the country were seen over here in the western region, near the Rocky Mountains, which makes sense as to why it has got the name that it has. So they were all over in this general region. And then if we compare that to the reported cases in the U.S. in 2014, you can see that this area that was just lit up red hot with cases is pretty well clear now. And that area has sort of shifted over to the Midwest, unfortunately right where we are, and over to the East Coast a little bit. So like I said, this has happened for a few reasons, but one of them can largely be traced to the warming and weather pattern changes that has led to tick habitat spreading. And this leads me to this study here, done by Kearns et al. 2017. And they looked at spotted fever groups, not necessarily Rocky Mountain spotted fever, since, like I've said, the testing is so hard to differentiate between all the specific groups. But I wanted to still look at this because Rocky Mountain spotted fever is still the most common group that is seen in Illinois, so it seemed fairly relevant here. So if you look down here, all these circles, the size indicates the number of cases. So Southern Illinois is kind of a hot spot, and I was right around this area with 84 cases, if you can believe it, when I ended up getting sick. So in this study, they looked at different weather data, so things like the average temperature of spring, winter, like when the ground would thaw after winter, rainfall, and different things like that. And they saw that an increase in the average temperatures of the seasons, coupled with shorter winters and less severe winters and earlier springs, all led to a better, sort of just like a huge breeding ground for ticks. So the number of ticks and the habitat range of these ticks increased greatly. And with that, that brought an increase in the incident rates of spotted fever throughout not only Illinois, but a large portion of the Midwest. Prevention of this disease is fairly simple if you just sort of start with the proper gear, if you're prepared to go outside. Things like deep bug repellent are one of the few that are actually effective in stopping ticks from biting you for the most part. Things like just boots, tall socks, pants, taping your pants off, doing all these things help prevent the ticks from getting on you, and that's the best way to prevent yourself from actually getting the disease. It's also very important to remove the ticks as soon as possible, and this goes back to how the disease is transmitted. It takes approximately 6 hours or so, or it can take up to 6 hours for the tick to actually transfer the bacteria once it's been on you and once it's finally bit you. So if you're able to remove the tick sooner, your chances of actually becoming sick decrease. Other small things like just avoiding walking in tall grass and meadows in the early to mid-springs when the ticks are sort of hatching and out and about looking for their next meal. And not only that, but I think education is essential to prevention, especially in areas in the Midwest. I think it is pretty important, and it would be pretty easy to just add some lesson plans into the school. And for older kids, this could be added into your science classes, your biology classes, or into your health class. And just, even if it's a quick lesson for one day about the symptoms to look out for, where this disease is most common, when it is most common in the seasons, things like this. And for the younger kids, I think it's important to even just send home a leaflet or email the parents or something to just let them know of the signs and symptoms that they should be looking out for in their kids. And with that, I would just like to thank you, but also reiterate that this shouldn't scare you. It's almost a 1 in a million chance that you get it, and it's very treatable as long as you get your care right away. Thank you.